Today we'll be talking about epicanthoplasty, but before we do, let's first discuss what an epicanthal fold is and why an epicanthoplasty is needed. An epicanthal fold is an excess of an eyelid skin on the medial side of the eye, and before people used to think that it was just skin only, but deeper understanding has shown that it is not only skin but excess fibrous tissue and excess superficial muscle that surrounds the eye. An epicanthoplasty is performed because when an epicanthal fold is present, it prevents the crease from going naturally medially. Because a natural crease follows the curvature of the superficial muscle of the eye, also known as the orbicularis oculi muscle. And this muscle is a sphincter muscle in that it closes in a sphincter manner, in a curvilinear, the fibers goes in a curvilinear fashion. And so a natural eyelid crease or double eyelid fold goes in a curvilinear fashion. It tapers off nasally. However, if an epicanthal fold exists, then this excess skin, but more importantly, a fibrous connection and increased muscle formation prevents the fold from occurring, and therefore a sharp curve comes down, and therefore a natural crease doesn't occur. Epicanthal fold is also known as a Mongolian fold, and in Korea they call it Mongol band, in short for Mongolian band, because in the past people thought that people from Mongolia had a lot of these traits. And many Koreans and many Chinese came from the Mongolian background, and therefore many patients have this banding. An epicanthoplasty has gone through many changes, and most recent advancements has come out of Korea, where an increased anatomic studies has revealed that it is not just an excess skin, but we have actually localized the exact fibrous banding that is occurring in the direction of the muscle. And therefore, with this better understanding and a better surgical techniques have come out. Most recent technique has been popularly known as magic epicanthoplasty. However, this term was not developed by the person who originally did the study. The surgeon who originally designed and conducted the study called it tension-free epicanthoplasty. However, the word magic epicanthoplasty is just a word that was applied for commercial use. But the proper term is tension-free. So why is tension-free such an important concept? Because in epicanthoplasty, the most important thing is preventing scar formation. Besides creating a nice medial aspect of the eye, one does not want to compromise scar formation, because this scar formation in the past has been notoriously been known to last forever. And therefore, scar control and wound healing understanding is important, and therefore the concept of tension-free came about, because a wound would heal well if there's no tension. However, any wound, if there's tension, will heal with scar. And with this better understanding of anatomy, what this quote magic epicanthoplasty or scarless epicanthoplasty, or not scarless but tension-free epicanthoplasty, what that is that the soft tissue and the skin is mobilized so that there is minimal scar, or at least tension is applied at the incision site. Aesthetically, a properly designed epicanthoplasty is very important in terms of how the overall eye looks, and therefore you should consult with your surgeon to see what kind of a design that would be made so that a aesthetically pleasing medial aspect of the eye is formed. And in my practice, roughly 80 to 90% of patients with epicanthofold receives an epicantoplasty. The reason why it is that high is because, as I mentioned, when one has an epicanthal fold or a band, then it prevents the natural fold from occurring. And a natural looking eye is an eye that allows the natural path of the fold to occur. So when that excess banding is present, then you would like to release that. So, so how come we don't do it on everybody? Well, you also have to look at the overall face of the person and measure the distance between the inner aspects of the eye. And for some patients, they are too narrow. And if an epicanthoplasty is performed, then it makes them look too narrow. And the pink aspect of the eye, also known as the caruncle, is shown too much. And that is inappropriate. So one has to use an aesthetic judgment and discuss with the patient whether a look with an epicanthoplasty will be appropriate and will be ideal.